Good afternoon, everyone. Thank you for having me. I actually am going to do this as impromptu. I have used LifeWave myself personally, and it works. So I don't know where to begin, because I'm a little shell-shocked today for multiple reasons. The medical community is in complete disarray, as all of you know. And I'm trying to put together a conference on January 15th. And the title of this event is God's Children, We Are Not for Sale. But the real fundamental flaw in that title is that we've already sold ourselves. And that's really hard to say. And we're fighting our way out of slavery because we have become slaves to the medical establishment. We have become, yes, the IRS. We have become slaves to the indoctrination in our school systems, and I'm going to let our next speaker take care of that. And as we begin to question and have begun to question with the pandemic of death that was promulgated by our government, the Department of Defense, and the establishment medical community of the CDC, NIH. My vision for Virginia is that we will be the first state in the union to do the following things. Because Virginia has been a state that leads the way. Do we have the courage in 2023 and 2024 to lead the way? Yes. This is how we do it. Number one, we pass legislation that outlaws anyone to distribute or inject any individual in this state with the COVID-19 shot. It is deadly and toxic and is not only killing the current generation, it's killing the next two. And if you don't believe me, you just have to know a little biology. Because as a woman, my ovaries, when I was still having children, was the blueprint for the next generation. But as soon as my next daughter is conceived, at her conception, not at her birth, not when she becomes a teenager, at her conception is the blueprint for her daughter. So when we inject pregnant mothers with a toxic, deadly shot, and we tell them it's for their own good. This is slavery. And we are killing the mothers, their unborn children, and the next generation. And we have our government and our pharmaceutical companies making billions and billions of dollars. That's my first step. Step number 2 is we outlaw the mandatory childhood vaccine schedule. That any vaccine that is given to anyone is a choice between the doctor and the patient. And I further want to take it a step further for all of our veterans, that our government has made guinea pigs. Amen. Because when you enlist in the military, They shoot you full of every kind of toxic vaccine that they can because they have the power to. And we need to hold them accountable. They are experimenting on healthy men and women. And I want to hold medical science to a higher standard. That we follow the rule, do no harm. And we keep that promise rather than lying to our patients. And I can say as a physician and a trained physician that they did a really good job of lying to us. And I'm not the only physician who says that. Dr. Paul Merrick, who lost his job at Centera because he was saving lives, okay? Unlike the other hospitals across this country, this state, and across this nation, who prescribed remdesivir, which they knew was deadly and continues to be deadly, and they continue to prescribe. And they continue to lie because it's profitable. And so the question is, are we willing to stand as a nation and as a state, and are we willing to lead? Or are we just going to wait, step back, and we're going to rely on our government officials? We're going to rely on those elected in office because that's their job. If I wait for the government officials to change policy, we'll all be dead. And they're rich. Yes. So I want to just tell you a little bit about the childhood vaccine schedule, and I don't want you to rely on me, because who am I? I'm just a little simple doctor who in the midst of COVID-19 decided to step out of my comfort zone and save lives in a way I hadn't been used to in a while. I'm a psychiatrist, and not only do I see the medical ramifications of this disease and all the other diseases, but I am convinced at this point in my career that if we do not stop the mandatory childhood vaccine schedule, we are going to have an epidemic of cognitive and neurological injury in all of our children. This book just came out. It's called Vax versus Unvaxxed. It was put together by Robert F. Kennedy, Jr., who is the founder of the Children's Health Defense, and Brian Hooker, who's a PhD. And it writes about the comparison and the dangers and the lies that are told by the vaccine industry. The primary lie that's told by the vaccine industry is these were all tested and shown to be safe. They were never tested against a placebo. Never, never, ever. Okay? And yet we're supposed to believe our doctor when we go in for our well child checks, okay? And on the first day of life, we give our children a hepatitis B shot. As I said last time, I don't know any newborn infant who's an IV drug user or sexually active, so why do we have to give them a hepatitis B shot? This is dissolving illusions, disease, vaccines, and forgotten history. What we're told by the medical establishment is that vaccines were the cause of the healthy nation that we have. Whoa. Yes, that's laughable, all right? Because they were not. Hygiene, indoor plumbing, washing our hands, and not having horses in the street were the cause of the plummet of disease. Turtles All the Way Down is recently released also, and it gives you all of the data. And I will tell you that no pharmaceutical companies have sued any of these authors because they can't. It's all the truth. This is a movie by Leslie Manookian, who wrote the Greater Good movie. She's vaccine injured. She was on Wall Street and said, I need to leave Wall Street and speak the truth. And she describes in graphic detail the dangers of the vaccine industry and all of those children who have been permanently harmed. We are told these are safe and effective. Everything is safe and effective. We've proven it. Here's the study. All right, when we look at safe and effective, we have to understand what that means. So what is the risk of you getting an illness and dying from the illness or being significantly harmed by the illness? When we look at COVID-19 in children, the risk of dying from COVID-19 is 99.997% or less. All right, most children have already had COVID-19. When they have it, they have a mild cold, but we also have to remember there's treatment available. Ivermectin, hydroxychloroquine, all right, vitamin D, vitamin C, elderberry, turmeric, numerous things are available to treat. We do not have to introduce into our children a toxic substance and only pray when they're on the football field or running track or playing a basketball game that they're not going to have a heart attack and die. Because we all watch the news, right? And that was just mysterious, okay? That rarely happens, okay? It used to be rare. It's not rare anymore. You have to look at the relative risk, and usually when we're talking about that the risk of what we're doing, comparison to the illness itself, we want a safety rate of like 1 in a million. We are seeing outrageous numbers of harm, particularly to our children. Neurological injury, heart disease, and with heart disease, there's a study that showed, and with this study, 1/3 of the children had cardiac injury. The disturbing part was that they were not all symptomatic. So they are ticking time bombs with cardiac disease. And then you have ads on television that say wonderful things like, we treat children for myocarditis, and they recovered. Well, what does recovery mean? From their standpoint, it means they walked out the door of the hospital. Out of sight, out of mind, no further problems. Myocarditis is a permanent injury to the heart. It will never heal. Then, this is one of my questions. Who enforces the law? School boards. All right? So in order to go to school, you have to bring in your mandatory schedule, and the school checks off. And if you aren't up to date, the school says, well, you can't start school. So why are we depriving our healthy children from attending school when they're not at risk to cause illness to somebody else? Because they're correct. Further, again, it's making them a part of the doctor-patient relationship. Secondly, the school is not educating people about religious exemptions and medical exemptions. So if you're going to take this role on, you better be informing every parent on the day of school or when they hand in their materials that they have the option for medical and religious exemptions and how they can go about getting those. And in my opinion, any family who has a vaccine-injured child, all of their remaining children should be checked very closely about what schedule they follow or not to follow in terms of the mandatory schedule. All right? The medical community is very good at denying what vaccine injury is. So if you have a high fever and are fussy after a vaccine, that's not normal. But your pediatrician will tell you that's average. That's okay, just see how they do. They wait and they escalate those symptoms. Oh, they had a seizure, a febrile seizure. Well, they recovered from that. We think they're fine and have the next round of vaccines. We need to think again. These are drugs pulled from the market since 1960, and this is the smallest. I want you to look at Zantac, Seldane, Vioxx, okay? As all of you know, Zantac was over the counter, all right? It was pulled because of the increased risk of gastric cancer. Even more. LSD was once over FDA approved. Did you know that? All right. Here's vaccines pulled from the market. More vaccines. Religious exemptions. So, in the great state of Virginia, where we think we have wonderful religious exemption law, and we do, except it's limited. You see, in a state of emergency, it goes away. And if you happen to work for UVA, they got to pick the religious exemptions that they would honor. So if you happen to fall in the wrong class of religions, your religious exemption didn't count, and you lost your job. Currently, the COVID, and this is individual hospitals can do what individual hospitals can do, because they, after all, if you have a private employer, you don't have a right to bodily autonomy in this state. Did you know that? Hold it, I work for a private company, I don't have bodily autonomy? Nope. You go to a private university or a private school, do you have bodily autonomy? Nope. Because they can force you to have a shot against your will, because that is their protocol. And the saddest part about being in Virginia is that our Attorney General did nothing to defend those people. There are good lawyers in this state who are standing up to those people, and we thank God for those lawyers. This is the childhood schedule. Looks like that, all right? Currently, this is before the mandatory COVID shot was added to the childhood vaccine schedule. It was over 70 shots by the time you're 18. Now you're going to add another 18 plus, because beginning at 6 months of age, if you follow the CDC guidelines, you will begin getting your children at 6 months of age injected with a toxic poison. But remember, it's safe and effective. This is the history of vaccines. So I want you to note the downward trend in every single vaccine: whooping cough, diphtheria, measles, scarlet fever, and polio. Every one of those illnesses had already peaked and was coming down before a vaccine was introduced. And yet we are told vaccines ended those deadly diseases. That's not what I see up there. This is an old slide. 54% of U.S. youth are chronically ill. Chronically ill. That's disturbing. And it is only getting worse. Because right now the rate of autism is 1 in 34, 1 in 35. All right? By 2030, it's expected to be 1 in 2. And then they say, well, we changed the diagnostic criteria. All right? Maybe. But when you go to a school, they have classrooms of autistic children. of brain-injured children. When I was in school, there might have been one in an entire school. But that's not what we're seeing now. And one of the things that disturbs me most is I will have families who tell me that one of their children was diagnosed with autism, then the second, and then the third. And they're not looking at the correlation between the vaccine schedule and that autism diagnosis. And one of the reasons why is because the pediatricians have been well trained. But Andy Wakefield was a gastroenterologist in the UK. So as a GI doc, he sees kids who were sick with GI problems. What does he have anything to say about autism? And he was coming in and he was finding the link, and all of these kids had GI dysfunction after childhood vaccines and were also diagnosed with autism. That they had completely normal developments until a round of vaccines. And what was his reward? For asking questions. So maybe we should look at the vaccine schedule. Maybe we should investigate this a little more. Maybe we should see what kids might be at risk for vaccine injury. They took his job. They took his medical license. But he's sort of like Yoda, right? I think he would laugh at that comparison. Because when you kill him, you make him stronger. So he is now a filmmaker and producing one film after another about vaccine injury. So then there's Dr. Paul Thomas here in the United States in Oregon. And he said, you know what, I'm going to do a study. I'm going to look at my patients who are unvaccinated by their choice, and my patients who are vaccinated. And he reviewed like 20 years of records. Okay, that's a good study. You know, it's one guy. This is your practice. I'm going to look at all of these parameters. I'm going to look at the vaccine people on one hand and the guys who weren't vaccinated on the other. And he found out that in every single category, the unvaccinated were healthier. So what did they do to him? They shut him down, took his license, said, we don't want you. You're not playing by the rules, and we make the rules. We also know that from COVID-19. So the doctors who have spoken out about treatment for COVID-19, because the medical establishment is inherently corrupt at multiple levels. And so they went after the board certifications of doctors, like Paul Merrick, Pierre Corey, and Peter McCullough. And Peter McCullough, they actually wanted to take his medical degree away. All right, so we're taking the degrees away from some of the most influential physicians in the world who have been speaking the truth because they don't make a profit off of it. They've labeled them crazy. Non-conforming. You got to play by the rules. All right? And we're going to put you in your little cell, and we're going to leave you there, and we hope that you're quiet. Here's some of the toxic additives to those vaccines. Aluminum, formaldehyde, polyethylene glycol, thimerosal, MSG, others. One of the things that you have to know about those is the pediatrician will tell you that they give you very small amounts of those. And so when you get the injections, we're not making you toxic. Well, the issue is, if you give one shot, that might be true. But in an average well child check, you get 3 to 5 and sometimes more. So the work of James Lyons Weiler, along with Paul Thomas and other doctors, has clearly shown that it is possible for a 2-year-old to be aluminum toxic from the normal vaccine schedule until he's well past the age of 2. We don't consider, okay, this is COVID shots. So how many are we going to give to our children, and what happens to their immune system? So just in my patients, I have a very small private practice. I've seen stroke, congestive heart failure, neurological disease, chronic illness, repeatedly. Their immune systems are completely shot. We see turbo cancer and turbo neurological injury. So I was giving a talk, and I talked about turbo Parkinson's disease. And one of the audience members, her husband, was just told that he had turbo Parkinson's disease. They hadn't ever seen Parkinson's progress at a rate like this. But of course, it's not related to any toxic shots he may have received. I was talking to an oncologist, and I said to him, "Aren't you seeing a lot of breast cancer? Isn't it alarming?" He said, "Yes." He was surprised I asked the question. And I said, "Do you have any thoughts about the origin of that?" He said, "No, we're going to have to wait for the studies to come out." I don't have to wait. One of the ethical things that we're told is that it's important that we all do this. Because if I get my shot, I'm going to protect you. If the children get the shot, they're going to protect their parents and their grandparents. This is turning medical ethics upside down. We don't sacrifice one life to save another. We don't. Because if I have kidney disease, is it okay for me to come and take your kidney? If I have, any sort of, if I'm uncomfortable with your presence, okay, that's what we've become. We've become a society that's based on feelings. If I'm uncomfortable with something you said or did, then you have to leave. All right? So we're doing that in the same field of medicine. Instead of making medical decisions based on fact and on knowledge and predictability, well, it feels good to do this. All right? This is what the CEO of the hospital says. I'm going to tell you about CEOs of the hospital. They're number crunchers. They're not doctors. All right? And when I worked in the hospital and in residential treatment, I've done worn a lot of hats over the years. When we would have some child that was really, really sick, I would say, "Can't we hold them? And this other kid who isn't so sick, let them go, because they're ready to go." It doesn't work like that. Why not? All right, it's just numbers. This is all, government money. I'm not overall extending anyone's stay. I just need 2 more days here, and this person doesn't need any more days. Nope. So this is real comforting for everyone. The new shot that they want you to get. Okay. was tested on 20 mice. I'm sure that makes you feel really comfortable. No humans, 20 mice. And I'm sure that those were 20 really healthy mice that they selectively picked. And they're going to give us a really good impression of the importance and all of the risk and benefits that you need to know when you take that shot. Right? 20 mice. The lies about myocarditis, pericarditis. Women, I think I've talked about this before, we take the biggest hit. 2/3 of vaccine injuries are in women. All right? And the disruption to the menstrual cycle is very clear, but women are not alone because men are also attacked. And what we found is that following the shot, we have a drop in the sperm count, drop in sperm size, and motility of the sperm. So do we have has that been reflected in the birth rate? In Taiwan, which has a 95% vaccination rate, they had a 28% drop in birth. And we can see that around the nation. And what we're told is that, well, it's just because it was COVID, right? People weren't together as much. We were locked in our houses, come on. And everyone knows this. After every snowstorm, 9 months later, there's a peak, okay? After every hurricane, 9 months later, there's a peak. But no, that didn't occur. The neurological injury, so the shot is made or encapsulated in a lipid nanoparticle. That means it loves fat, so fat likes fat. Goes to every organ system in the body. And the brain and every nerve cell is surrounded by myelin, which is made of fat. And so that lipid nanoparticle goes into that myelin and causes inflammation. And this is one of the reasons we're seeing a huge increase in neurological disease, MS, ALS, and all of these other neurological diseases. And for the first time in my life, I've heard of dementia and ALS in children. But again, it's safe and effective. Guillain-Barré, absolutely. So, lastly, as I wrap up, we're in the fight for our lives, and all of you know that. In our medical community, there are good doctors. You have to look for them. There are great naturopaths and holistic doctors out there. Cling to them. Don't be afraid to challenge your doctors. Don't be afraid to give them information and ask them to look. Tell them about what you've witnessed. The number of people that you have witnessed with cancer, neurological disease, death. Don't let them off the hook because they want to keep their heads buried in the sand. And we cannot allow that to happen. And lastly, I want to say that we have to, as we protect all born children, we need to protect every unborn child. Because those who are saying, this is a woman's right, it's my body, my choice, are deluded. But I want you to know why they push so hard. Because it allows them to rip the heart and soul out of women. Because there isn't a woman alive who's had an abortion that recovers. And they may say it's simple, because the majority of abortions, you just take a pill. It's all over. It's not. It's decades and decades of pain. And we live in a state where it's easier to promote that than say to a woman, hey, you're in a problem pregnancy, I'm going to do whatever I can to help you deliver that child. There isn't equal opportunity in this state. It's one choice. Here, take this simple pill because it makes the problem go away. But this is the further problem. See, all these vaccines, and many of the vaccines, were made with the products of abortion. So those children that were born alive, got those cells taken, were sacrificed for the field of medicine. And the field of medicine has a scourge upon it that will take decades to remove. And those who did that in the field of medicine, may God have mercy on them. Because this is the greatest sin. And we are, as a medical field, there are very few doctors who are willing to stand and speak the truth. I'm willing to do that because I cannot stomach watching the pain one more day. I can't stomach one more day of sacrificing our children to shots. And I can't take one more day when our elderly or those in the hospital are completely disregarded and that their loved ones are kept from their bedside. And the doctor says, I know what's best. Correct. We have to stand and not let ourselves continue to be slaves to the medical establishment. So if you're on one of those long lists of medications, and I recognize the problems that you may have, today must be the day that you start to heal your body. Today. Where you begin changing what you put into your body. You make holistic decisions, and you taper that list one at a time and reclaim your life. And stop being a slave to the pharmaceutical industry and to the hospital complex. Thank you.
Thank you.